Hi there, I'm Penny Eggers, clinical educator for Echo Healthcare, and today we're going to talk about our hyper-realistic mannequin, Alice. And I'm going to take you through some basic things that Alice can do. First, we're going to start with the Airway, which is a simple BVM. You're going to note that you're going to get chest rise and fall just like you would see in a regular person. Alice also has a very realistic airway. She can be intubated with a 4 Mac, a 4 Miller, using anywhere from a 7.0 tube to an 8.0 tube. I'm just going to show you what a nice airway she has, and we're going to show you on the video here. Let me know if you can see that. And there's her airway right there. Now we're going to insert the tube. All right, I'm going to blow up the pilot balloon, and you're going to see that we are going to get good bag compliance as well as nice chest rise and fall. So let me turn that on so we can show you the pressures when you were bagging her. As you can see, we're getting really good, nice chest rise and fall, and our volume of liters of air, of ventilation, is going to be right around the 492. Did that pick up okay? She can also be ventilated or intubated with any supraglottic airway as well. Now moving down here, we're going to look at, we have a needle decompression. She can be decompressed on either side. It is anatomically correct. Now you will not get any rush of air. This is for task skill training only. You can do CPR on Alice or any of our mannequins. We recommend that if you do use a device, we don't use the Autopulse. A Lucas device will be okay for a short period of time, not a long period of time. That way it won't tear up the inside. She does have bilateral humeral head IOs that each one of them have a blood pod. So when you insert the IO needle, you will get a small bit of blood return. You can see I have one set up here in her proximal tibia as well. And you can see that I get a little bit of blood return. You're not going to get a whole bunch. We don't want a whole bunch. It's just for demonstration purpose only. It's a small blood pod, but she has bilateral proximal tibial sites as well. IVs, they are, I put an IV already established in her right arm here. Now, they're not cannulated, so when you start the IV, they're completely just for task training only. However, if you do want to push medications or you're doing a skill where you want to do drug calculations or fluid resuscitation, what I've done in the past for my own classes, what I've done is I went ahead and attached a 3-way stopcock to the end of our IV tubing. As you can see here, I have a bag placed up on the top rung here. It is attached to my IV tubing here, but what I did is I piggybacked a fake one. So I have an empty IV bag here. I have it attached here at our lower lock. I put it under the table, and then I control whether I want to have them give medications IV directly bolus, or if they're going to give a fluid bolus as well by just turning on and off that through a stopcock. And that's just kind of a way to bypass it. One other thing that I'd like to do with my mannequins is kind of try to bring them to life a little bit, because these are hyper-realism versus high fidelity. What I did is I purchased, this is a Soundburner metronome. It's run off of an app. It's run off an app here. So I can change the cadence of this to give it pulses. And you can see it looks like it's vibrating pretty well. So I can turn this down to, let's say I want to make her bradycardic. I can lower the pulse, and you can see this is now slowed down. It gives a nice vibration here, so all they do is feel the radial pulses, and they can feel that this pulse is now slow. If I want to make it a little tachycardic, all I do is turn my wheel here. I can make it tachycardic, and now you can see that the light's pulsing faster as well as the vibration. If you have any questions or you want to learn further about our products or training or tips and tricks of how to make your simulators come alive, you can contact me, Penny Eggers, at Echo Healthcare Simulation, and I'll be happy to answer any further questions. Thank you very much.